Hello everyone and welcome to Module 2. This week we are focusing on minor surgery and infection control and kind of all of the pieces that would be responsible as a medical assistant in regards to that topic. Now there are no chapter readings for this week. So instead, what I'm going to do is talk about some of the procedural things that we will be doing within the lab class, so that way you can prepare yourself before you come in, and so that way when we go to start doing these procedures, we can go right to a competency stage instead of having to kind of backtrack and go back over them. So the first thing that I want to talk about is the topic of surgical hand scrubbing. Now, as a medical assistant, you may be asked at times to help the provider with a minor surgery, and there are some specific ways that we do that. First and foremost, we set up a sterile field, and when we're doing a sterile environment and we're setting that up, what we use that for is we call that surgical asepsis. Now, there is an opposite side to that is called medical asepsis, and we are going to talk about both in the lab this week. But medical asepsis is more the technique of being clean, so making sure that we're washing our hands, making sure that we are using the proper protective equipment or PPE, making sure that we clean up areas after we're done with them, and making sure that we disinfect. All of that is to help stop the spread of infection. Now, a surgical asepsis, on the other hand, is actually what we call a sterile technique. That means that there are no microorganisms present, as they have all been destroyed during that sterilization process. This is where we would use surgical scrubbing, sterilization, wrapping and labeling, as well as using surgical gloves and setting up that sterile field. Now, when you do a surgical scrub, it is very different from that of a medical aseptic hand wash. First and foremost, you want to make sure that you're using a sterile equipment. So you'll notice that they have a sponge brush here in the video, or in this picture, and that sponge brush is actually already impregnated with surgical soap. So what that actually means is that the sponge is already pre-assembled. The first thing that you'll notice is that you want to open that sterile package away from your body, and you want to remove any jewelry that you have on. Now, I say that with a little bit of an asterisk, because we cannot ask you to remove any religious affiliated jewelry, whether that be bracelets or rings, and we cannot ask you to remove wedding bands. However, if you can, it's always best to, because some of that does get stuck, some of the bacteria does get stuck under your rings, and I also don't want to stain your rings. So if you can, just remove them. You want to roll up your sleeves, and you want to make sure that you also remove any lab coats or roll them up. After you have removed all your jewelry, you're going to use a paper towel to turn on the faucet and adjust the water to lukewarm. You want to make sure that that's really important, that you get it to a lukewarm instead of just going straight for super hot, because you will end up burning your hands. Then you want to make sure that you discard that paper towel into a waste receptacle, because of the fact that you don't want to use that again, you don't want to touch that again. And then you're going to wet your hands and apply soap. So you're actually going to do a medical hand wash first, and then you're going to actually move forward into using the surgical scrub. In the surgical scrub pack, you will find a nail pick. That is what you're going to start with. You're going to make sure that you use that under each fingernail. And you want to make sure that between each fingernail you do rinse off the nail pick, so that any bacteria does not get transferred from one finger to another. Once that is done, the important thing here is that we are keeping our arms above our waist. So you will just turn and drop the nail pick into a garbage and not actually remove your hand lower than your waist. Then you are going to take the sponge brush, get it wet to activate the suds, and you're going to start cleaning from fingertips to elbow. You want to scrub each hand about 5 minutes. You want to do both the sponge side and the scrub side, again, to remove any of that bacteria that's on the surface and any dead skin cells that are there. Once both hands have been washed for the appropriate amount of time, you are going to rinse then from your fingertips to your elbows. Again, that is so any bacteria that is on the fingertips or towards the top of the hand actually does run off to the back side of the body. So when you're in surgery, it's not going to be exposed. And again, we want to make sure that we are keeping our hands at our waist. Okay, we don't want to drop them below that. Then you can use paper towels to dry your hands, blotting from the hands to the elbows, and discard each paper towel after it's used. Then take another paper towel and turn off the faucet. We don't want to touch them with our clean hands. The other thing that's really important here is that you can, at this point, actually go directly into your surgical room and get yourself prepared. Next, we have surgical gloving. And with the surgical gloving, the important thing here is that we're putting on gloves that will not be contaminated already. Where the non-sterile gloves, it can actually have some of that, but it's okay because we're not doing a clean procedure or a sterile procedure. So what you want to do, first and foremost, is you want to glove your dominant hand first. This is really important because of the fact that your dominant hand is what you're most comfortable with. So that's what you want to start with. After you have gloved your dominant hand, it's important to remember that you do not want to touch the outside of the glove, sterile glove, with your non-gloved hand. You can touch the inside because it was already contaminated. And any sort of sterile packaging, specifically that around a surgical glove, you can touch the outside 1-inch border because that is considered contaminated. After you have your dominant hand gloved, you are going to then move on to your non-dominant hand. Now at this point, because your dominant hand is gloved, we do not want to touch the inside of the glove with our gloved hand. Again, because the inside is now contaminated, you can touch the outside of the packaging. And the last topic I'm going to talk about is actually opening a sterile package. Like you've already heard me say, the first flap or the first opening should always be away from your body. Again, your body does have bacteria on it, so we don't want to open a sterile package towards ourselves. We want to actually do it away from us. Then the next thing that you'll want to do is move to the sides if they're there, and then the final one will actually be towards you and your body. If you have a sterile package that doesn't have sides, the first thing you want to do is kind of open that and drop it onto a clean, dry surface, and then you can open the edges from there. Again, remember the 1-inch border on the outside is considered contaminated, so you can actually touch that with your fingers that are non-gloved, and then from there you can kind of open it the rest of the way. All right, guys, that is what I have for our content this week. It's not as long as some of the other videos, but I do want to make sure that you guys are kind of getting an idea of what we'll be doing in class, so that way you can be prepared. If you want to look over some of these procedural chapters and you want to look over maybe some of those procedures from the chapters, Chapter 34 is a good chapter to start with. It will go over some of the infection control techniques. And another one that you can actually look for, and if you want to look at procedural things, is actually going to be Chapter 48. That's going to be talking about surgical asepsis and the sterilization techniques such as scrubbing, gowning, and gloving. So if that is somewhere you want to look, absolutely. Otherwise, again, Chapter 34 is what actually has some of those infection techniques and infection control procedures. I look forward to seeing all of you in class on Thursday. Have a wonderful week. Bye, guys.